We had a group of community leaders. We came together sometimes at 7:30 in the morning to come up with the non-pharmaceutical prescription pad. We felt that there was a great need in the community. Instead of giving a patient a prescription for some drugs, that we can start with providing them information that will help them to make lifestyle changes instead of a pill. Because a lot of conditions can be treated initially with lifestyle changes.
Kenosha County ranks 64 out of 72 in the county health ranking. So while there's many great things happening in Kenosha, we have a lot of work to do around chronic disease. As the WIC provider here, we've always been concerned about access and affordability of healthy foods for our family. This grant really allowed us to take that to another level too by changing the environment and some of the policies and systems in our community.
We facilitate the Nurturing Fathers program. That's an evidence-based program used to cultivate and support some of the attitudes and beliefs of the fathers, hoping to benefit the entire family. Talk about relationships and partnerships and teamwork and communication and things like that. So that side of it is the coursework. We take them through a 13-week curriculum. The families get together and, the dads have an opportunity to kind of talk about what they learned, and it's a dramatic change from the start when they started to the end. Many of the dads express how life-changing it was for them. They've been able to mend relationships with the mother of their children.
One of the great things that K-HIP Farmers Market Work Group is working toward is making fresh, locally grown produce accessible to members of the community. We are just making awareness of the opportunities that already exist to get this food, as well as kind of expanding on those opportunities.
We partnered with store directors, managers, and those that had dietitians in the grocery store. Together we created the vegetable of the month, produce pick of the month. So our families here at the WIC clinic would sample the recipes, and then they would find the recipes at the grocery stores when they were doing their weekly shopping. We developed a non-pharmaceutical prescription pad, Eat, Move, Thrive, and this was done in conjunction with many of our community partners. Our WIC staff here, anyone that's serving families, can have a tool to talk about exercise, nutrition, and then self-care as well. And this is a tool that is available for the community, that access to healthy foods is a right and not a privilege. And for everyone to come together and to share their time and expertise was just great. Some of the other work that happened with our farmer markets was partnering with our local university here, so UW Parkside. We partnered with their app factory, and we actually developed an app for our farmer markets, so our families can download the app on their phone and they can identify which markets are available at any given day of the week.
It has a mapping feature as well as a link to your calendar, so anyone from the community can download this app. They can use it to find a market near them, find the days the market run, find what payment options are accepted at the market.
Seeing the success that I had gotten with my patients, as a medical provider, I feel it is absolutely important that this program be continued, and I will work my hardest to get it, to recommend it to other providers, which I have been doing, because it does work.